everyone. Thank you very much for joining today's session. Today we are going to be talking about blood pressure. We will discuss what blood pressure is, the complications of high blood pressure, and how to manage your blood pressure. So what is blood pressure? Blood pressure is the measurement of force of blood pushing against the blood vessel walls. When we measure our blood pressure, we get two different numbers. The first is your systolic. This is the measure of pressure in the vessels when the heart contracts, pumping blood through those arteries. This is the top number of your blood pressure reading. Diastolic is the measure of pressure in the arteries when the heart relaxes between beats. This is the bottom number in your blood pressure reading. An easy way to remember is systolic to the sky, aka systolic is your top number. For those who are living with cardiovascular disease, the recommended resting blood pressure value is less than 120/80. Hypertension is considered to be high blood pressure, or another name for high blood pressure. Generally, those with hypertension would have readings of 140/90 or above. When we have hypertension or high blood pressure, that is when we have too much pressure in those blood vessels. High blood pressure is similar to pumping too much air or tire into a balloon. It will weaken or damage those vessel walls. Heart and Stroke has come up with some categories, so you can sort of see where your blood pressure falls. Ideally, we would like to be in this low risk area, so 120/80 or below. Once our numbers start creeping up a little bit, we might want to be mindful of that. It could be a conversation with our doctor if we start to get closer to that hypertension area. So medium risk would be considered 121 to 134/80 to 84, and a high risk reading would be 135 or higher over 85 or higher. So what are some of the complications of high blood pressure? Generally, we don't actually feel if our blood pressure is high. We don't have many symptoms. That is why they do call it that silent killer. But over time, uncontrolled high blood pressure can cause a lot of issues to a number of organs and systems within the body. One that we may, come to mind first would be that heart muscle. So uncontrolled high blood pressure can damage the blood vessels that supply the heart, which affects the heart's ability to supply and pump blood efficiently throughout the body. Damage to those artery walls through high blood pressure also leads to plaque development. This can lead to, again, coronary artery disease, that plaque development, potentially angina, arrhythmias, heart attack, and even heart failure. Another system that is affected is the kidneys. So high blood pressure can damage the blood vessels that supply the kidneys, which act as filters to remove waste products from the blood. Over time, uncontrolled high blood pressure can cause arteries around the kidneys to narrow and weaken or harden. And these damaged arteries are not able to deliver enough blood to the kidney tissue, which can lead to kidney disease and eventually even kidney failure. Another system that's affected is the eyes. So uncontrolled high blood pressure can damage those blood vessels that supply the eyes, which can lead to something called retinopathy and even vision loss. It can affect different areas in our periphery as well, namely some of our limbs. A lot of times that can happen in our legs, so it can damage the blood vessels that are supplying blood to different limbs. This leads to something called peripheral artery disease, usually happening in the legs or the lower extremities, and it's the narrowing or the blockage of the blood vessels that carry blood from the heart to the legs. Again, uncontrolled blood pressure can damage the blood vessels that supply and nourish the brain, which can lead to stroke, a transient ischemic attack, or something called a TIA, and also some cognitive impairments. As we learned on the last slide, high blood pressure can have a big impact on our cardiovascular system and that heart muscle. So we know that it can lead to damage of the artery walls, which leads to plaque development, and it can also affect the muscle of the heart as well. When we have high blood pressure, the heart has to work harder with each and every beat to eject blood flow out to the rest of the body. And the heart is actually the only muscle in the body we don't want to get big and bulky, like some of those other muscles we may be working to try to get a little bit bigger. We actually don't want to see that. So if you look at the second picture there on this slide, we don't actually want to see this buildup of muscle mass, because that affects your heart's ability to dilate and take in blood to those ventricles and then eject it to the rest of the body. The heart sort of becomes stiff, and it affects our heart's ability to pump. So every time the heart has to try to work against ejecting blood against a higher pressure, we can have developed this buildup over time, which is actually something we don't want to see. So that's another one of the complications of high blood pressure that can develop. So what are some of the causes, and then how can we manage those causes? So one of the first ones that we always say is always sort of an answer in this program would be physical inactivity, and then obviously the answer to that and how we would manage that would be getting in our regular exercise. So physical activity is one of the risk factors for developing high blood pressure. So how do we manage that? And it would be that each week we do want to be aiming to complete that 150 to 300 minutes of cardio-based exercise and at least 2 days of our resistance training. Increasing our physical activity levels helps to relax your blood vessels. It reduces the workload on the heart, and just like medications, nutrition, your physical activity and exercise must be habitual in order to receive that consistent sort of daily positive effects on your blood pressure. So just like you would have to take your blood pressure medication every day for it to work well, you need to do the same with exercise, getting in your consistent regular exercise. Another risk factor for developing high blood pressure is poor dietary habits, specifically sodium when we are talking with blood pressure. I know there's other dietary habits that affect other risk factors, but specifically with blood pressure, we do talk about sodium. So sodium is a mineral that supports vital functions in the body, and it is regulated by your kidneys, and it helps to control your body's fluid balance, and it also affects nerve impulses and muscle function. So it does play an important part of the body. But when we consume excess sodium, your body pulls water into your blood vessels in an effort to dilute that sodium, and that will increase the total volume inside the blood vessels, which will increase the pressure in the artery walls. So when we are talking about how to manage that, we would really focus on sodium reduction. So it would be following our Mediterranean diet, following Canada's food guide, practicing mindful eating, reducing processed foods, which tend to be really where we're getting a lot of our sodium from. So most sodium we're consuming is actually not from the salt shaker that we're putting into our food or at the table. It is those processed foods is where most of the sodium is coming from. And then, of course, trying to reduce our salt intake. The next risk factor for development of high blood pressure would be poor sleeping habits. So when we are not getting adequate sleep, that will actually increase our blood pressure. So one night of poor sleep will increase our blood pressure for up to a 24-hour period. So how we can manage that is practicing good sleep hygiene. We have a whole talk on sleep, so you can go have a look at that in regards to sleep hygiene, and then managing sleep apnea as well. If you have been diagnosed with sleep apnea will also increase your blood pressure. Unmanaged stress is also another cause of high blood pressure. Stress will release hormones that actually cause constriction of those vessels. If we have smaller vessels, that is going to cause higher pressure in the arteries. So in regards to trying to manage that, we would want to try some stress management techniques, potentially meditation, exercise, and having some supportive social networks. Another cause or risk factor for developing high blood pressure would be smoking and excessive alcohol consumption. Smoking will cause constriction of the vessels, which will increase the pressure in those vessels or the arteries. And excessive alcohol consumption, it can cause stiffening of the artery walls, which will also increase the pressure. So in regards to managing this risk factor, it is recommended working towards smoking cessation and becoming smoke-free, and following the alcohol guidelines, which is currently for low-risk guidelines, no more than 2 drinks per week. Another risk factor, these would be considered to be non-modifiable risk factors. So unfortunately, these are risk factors we may have that we don't really have much control over, would be age, family history, and ethnicity. So as we get older, unfortunately, our family history and certain ethnicities do have a higher chance of developing high blood pressure. So in regards to how to manage these, it really would be compliance with your medication. So sometimes we can make all the best choices and we're still going to have potentially that higher blood pressure. So being compliant and taking medications as prescribed and doing everything we can in regards to all those modifiable risk factors that we had talked about on those last few slides. All right, that is the end of the session. We'll just do a little test your knowledge to see if you were listening. So which of the following statements is incorrect? So we have high blood pressure can damage the blood vessels in your eyes. Employing stress management techniques can help to manage your blood pressure. Poor sleeping habits can contribute to high blood pressure, and diastolic pressure is the top number of your blood pressure reading. So the answer there is D. So diastolic is the bottom number of your blood pressure reading. Something we want to ask ourselves every week, just when we do these education sessions, is, are you working towards a goal? What went well in regards to that goal? What can you do differently? And how can we support you in those goals? If you would like more information, please speak with your exercise therapist. Visit our website at www.gethearthealthy.ca, and you can always view our calendar of live events on the website. Thank you.